Vaccine is being allocated to the states based on population numbers, which means it's based on the number of people who live in each state. Given the limited number of doses Idaho is receiving, we want to make sure Idahoans who live and work here have as much access to the vaccine as possible so we can stop the spread of COVID-19 in our state. That is why the state of Idaho is now requiring that those seeking COVID-19 vaccines in the state should either live or work in Idaho. Regardless of citizenship or immigration statuses, all eligible people who live or work in Idaho should get vaccinated when it's their turn. People who do not live or work in Idaho should make vaccine appointments in the states in which they have a primary residence. People who register for vaccines with any vaccine provider in Idaho will be asked to provide one of the following: a driver's license, a work or school ID, a letter with the person's name and address, a utility bill with the person's name, or a voucher from an employer, faith-based institution, healthcare provider, school, or any other organization or agency that verifies the person lives or works in Idaho. Finally, I want to mention that those individuals who are homeless in Idaho will be eligible for the COVID-19 vaccine in group 2.3. That's our next group. This announcement does not change their ability to get vaccinated when we move to group 2.3.
So we do know that there are other states that have made the same declaration about restricting vaccines. We know Washington, for example, Utah, there may be others. I know that there are other states considering this. As I talk to my peers across the country, we've heard stories of even, large groups of individuals being transported from one state to another because the vaccine prioritization is different in different states. So I think we all, from public health standpoint, what our biggest care is that people get the vaccine who want the vaccine.
We do estimate that there's about 38,000 to 41,000 people who work in Idaho but don't live in Idaho. They could still get vaccinated here. And to date, as near as we can tell, about 4,800 people have been vaccinated who didn't live or work in Idaho, that have been vaccinated in Idaho. And so we're really just trying to acknowledge that we've gotten much quicker getting doses out, which makes this a more attractive place for people to come get vaccinated. And we want to make sure we get those vaccines in the arms of those who live or work here.